Hi, everyone. My name is Lauren Dickerman, and I am a women's health physical therapist and women's health consultant to various startups, mid-sized organizations, and the University of Miami through our FemTech program. We are so excited to welcome our second guest to our new initiative, FemTech Friday. It is my pleasure to introduce Mitch Rosen, a leader who has spent nearly 25 years bringing groundbreaking femtech innovations to market across multiple countries and disciplines. Mitch's career spans nearly every corner of women's health: contraception, hormone therapy, osteoporosis, incontinence, pelvic organ prolapse, bacterial vaginosis, and trichomoniasis. He has worked across pharmaceutical, procedural, surgical categories. And today he leads marketing and social media efforts for two critical innovations, Phexxi and SOLOSEC. Beyond his corporate leadership, Mitch has dedicated more than a decade to nonprofit service. He previously served as board chair for the Texas campaign to prevent teen pregnancy, and today he proudly serves on the board of Healthy Futures of Texas. Mitch often says he is fortunate that his work aligns with both his passions and his strengths. He is also proud to share that he is neurodivergent on the autism spectrum, something that he considers a superpower in his professional role, enabling him to see connections, opportunities, and solutions in unique ways. In addition to leading at EvoFem, Mitch consults with other femtech organizations and finds great joy in advising people who are looking to enter the field, helping them carve their own paths in this vital space. Please join me in welcoming Mitch Rosen, a passionate advocate, strategist, and voice of women's health innovation. Mitch, thank you so much for joining us and for all that you've done for women's health and innovation. Truly, your dedication to your dedication to breaking down barriers and empowering the next generation of women's leaders is truly inspiring, and we're so grateful for your time today. For some extra background, Mitch and I first met at a book club called FemTech Shelf Book Club. It's something that you should all join. And when I met him, I knew immediately that he was someone that I just had to get to know. So welcome. Thank you for taking the time.
Thanks for having me. It's great to be here, and thanks for all you do and this platform. I think it's a really needed, wonderful place for this femtech community. So thanks to you. And yes, please join the FemTech Book Club. It is such an amazing community. If you are even the slightest interested in femtech and sexual and reproductive health, the conversations are amazing. So please join us.
I couldn't agree more. Okay, so let's get into you, Mitch. So can you tell us about EvoFem, this amazing company that you're part of? Kind of give us some insights behind the team of EvoFem and the innovation that you're doing there, and more specifically about your role within the company.
So with EvoFem, I mean, it's a family. I mean, we are a small startup, trying to bring innovation in femtech and reproductive health. And like you said, with Phexxi and SOLOSEC, birth control and BV and Trick. And it really starts with our CEO, Sandra Pelletier. And if anybody's on social media, I encourage everyone to follow her, watch her TED Talk. Pelletier's Pelletier. Just an amazing human being, and to have number one, to have such an amazing, dynamic, powerful woman in charge of a women's health company uh, is is refreshing, having been in this space for 25 years. But she's just a badass. Like, she has so much energy and caring and compassion, and she brings that to the team every single day. And I think it really sets the tone for the company and how we operate and how we're trying to break down barriers and do things differently. And I think when you look at the team that we have, this isn't just a job and a company. Like, the employees here follow Sandra's lead, and the people that are on us with this mission, because it is a mission, right? This is not just a paycheck. This is a calling, and everyone here really feels like we're here to better society. And I think that's the beauty of femtech too, being so underinvested, is there is such a need. So the people that are in this space really have a caring for it. And the last thing I'll say about Sandra is she really wants to help this community grow. And I'm with her a lot. We talk a lot, and if there's something I hear her say more than anything is a candle loses nothing by lighting another candle. And she genuinely wants to help other people, other companies, other organizations, and spotlight things that are meaningful to society. So that's kind of the company and our leadership and how we operate. And as far as my work, the one thing I love dealing with kind of commercial strategy and innovation is in a startup, you get to wear a lot of hats. You have to wear a lot of hats. And I absolutely love that. So I deal with marketing, social media, I do clinical presentations, national conferences, key opinion leaders. And with that, I get to meet so many amazing people like you, Lauren. And my week is just filled with these conversations with founders and learning about technologies and talking to key opinion leaders and influencers, that it really just gives me so much hope in this space, because I get to spend my days just talking to amazing people that are doing good in this world. So it's been, I feel blessed to be in this type of role for 25 years and now doing it with Fem, Phexxi, and SOLOSEC.
Oh, so amazing. Yes. For everybody that's out there, follow both Mitch and Sandra. They're incredible. They're such powerful educators, advocates, truly people that want other people to succeed and empower others, and really break down barriers to improve control. I think it's incredible, the work that you're doing. And I had read something last night that Sandra had said in an interview, that doing good and doing well are not mutually exclusive, and a company with a conscience can still drive meaningful change. And I think that is so important. And I think that it really is, for many of us, like you said, in the women's health and kind of femtech ecosystem, that's our superpower. And you guys certainly are doing an amazing job at that. And we'll kind of get into how you are doing that more through our conversation today. So if we could, can we get more specific on the actual products that you guys are developing, Phexxi and SOLOSEC? Can you tell us about the products and maybe explain to us the target population and how you see these products existing in the world, and maybe some new uses or some new target populations that you anticipate being helpful?
Absolutely. I'll start with SOLOSEC because it really is, it's just a differentiator in a class for bacterial vaginosis and trichomoniasis. And you look at the prevalence of both, and especially the rates of recurrent BV, and sometimes the burden of compliance and taking something multiple times a day for multiple days. So with SOLOSEC, so it's Solo 1, secnitazole. So you have a single dose oral treatment for bacterial vaginosis and trick. So it is truly a one and done.
Amazing.
And all it is, we love it. And we get such great responses from it, because a lot of times people feel better and they don't finish their course of treatment, and then they're coming back later with recurrent BV. So to have something that's one and done, all it is a little packet of granules. You sprinkle it in applesauce, pudding, yogurt, consume it. That is the entire course of treatment. So that is SOLOSEC. And Phexxi, I'm going to give everybody on this call some breaking news that at the end of this year, Phexxi is not going to be called Phexxi. It is going to be called Phexx, okay? You're among the first to know, and that'll be a separate call for why companies change names of products, and that's a whole other story for another day. With Phexxi, we have a birth control with no hormones. You only use it when you need it. It is a vaginally applied product, inserted product, and all of the ingredients we commonly find in food: lactic acid, citric acid, and potassium bitartrate. And all it does, the vagina is naturally acidic, and sex and semen is increasing the pH of the vagina. That helps sperm swim. So Phexxi in itself is not changing the pH of the vagina. It's maintaining the acidity of the vagina in the presence of semen to immobilize sperm. And it is bioadhesive. Okay, not doing a good job here, but it does stay in place. It will not be messy or drippy in the vagina. It does have lubricating properties. And with that, we have some pretty interesting data, peer-reviewed, published in the Journal of Sexual Medicine, to be able to actually talk about sexual satisfaction, right? If we're talking about birth control, that means we're talking about sex. Let's talk about sex. Let's talk about pleasure, consent, trust, communication. So, but pleasure, it's an important thing. We're talking about sex. So I think one of the tricky things when you asked about kind of who it's for, the one piece is that I think is tricky. This could be someone's first form of birth control, right? This could be for the 15-year-old and their perimenopausal mother, right? So when it comes to marketing and educating, sometimes it's tricky because both of those people are going to consume and search and look for information in vastly different ways. So how we engage on social media and education and websites sometimes is tricky. And then, when you break it down, this could also be someone's primary method of birth control. It could also be someone's backup method of birth control. We had a doctor that did a video for us a couple weeks back, and she kind of coined the term pre-emergency contraception, where if someone's missing a few pills and they happen to be sexually active and they don't know if their partner has a condom, you have something to protect yourself in your purse next to your bed before sex instead of after. And then you look into the unique patient types, right? This could be, again, first or last birth control. It could be a backup. It could be someone that's in perimenopause or postpartum, or just not sexually active every day and doesn't want to take something every day, or can't take hormones for concomitant medications or underlying health conditions. Or even now GLP-1s could impact the absorption of oral medication, including oral contraception. And the last thing, especially I think is important in the college university setting, is the term stealthing. And not everybody knows the term stealthing, but when they hear what it is, it's non-consensual condom removal. And in age brackets, it happens at alarming rates. And if you don't know your partner early on in a relationship, to have something to protect yourself is really important. And that's kind of where Phexxi has really gained traction at colleges and universities. So when you look at that whole scope, there's so many. When we brought Phexxi to market, it's like, oh, well, this is kind of a niche product. And in a way it is when you look at all of those patient populations, but when you bring that together, it is truly, for the majority of patients, it could be, because so many people fit into those buckets. And then just the total numbers are, when you look at the people that leave their healthcare professional, 1 in 3 leaves with no prescription birth control, right? Which means there are gaps. And that's where Phexxi is really here to address those gaps, especially when it comes to non-hormonal birth control. And I think there was a question that came in about, is it evidence-based?
Yes, I was going to ask you, Mitch, because it came from the audience, but I thought you did a great job. You presented some research that's there, and I think that it's definitely important to say that they're both FDA approved and have gone through rigorous science to be able to get to this point. So yeah, if you could speak to that, could you elaborate if there's anything more?
Absolutely. So Phexxi's now been on the market for 5 years. It is FDA approved. It has gone through full clinical trials, phase 1, phase 2, phase 3, and now in post-marketing. So yes, a lot of data to support what we have. So definitely evidence-based. And the one thing I'll add too, with the approval, and there's one thing to have an FDA approved prescription product. I don't know if I mentioned it was prescription. Is it's also covered by the great majority of insurance plans and state Medicaid plans. So not only do you have options, but you have accessible options for patients.
Yeah, incredible. That's incredible. And I think, Mitch, another thing I'd love for the audience to know too is, Sandra has been doing such an incredible job in the breast cancer space and the oncology space, and I think one of the target markets that you and I have talked about for that product are these women that are going through some kind of oncology treatment that may not be able to use hormone birth control, and this might be the alternative for them, their choice, this option for them, which I think is such a relevant market because unfortunately so many women are going through that. And so you truly are, you're developing a product for the masses that has so many applications to so many populations, which is amazing, really amazing. So great job. Okay, so we know that you develop great products, and we know that you come from an incredible team, and we know that advocacy and education are just so important and just core values to your company and to the team. Can you tell us about this amazing campaign that you ran in August, the Save Vagina campaign, and kind of tell us the success with that? Tell us where it's going to go from here. Yeah, we're just so excited to learn about this incredible campaign.
Thanks for bringing that up, because it really was a passion project that arose out of a need. Listen, we're not the first people to talk about this, but the Save Vagina month. So for everybody the next phase is going to be the SaveVaginaStore.com, of SaveVaginaStore.com, where proceeds will go to charity. But Save Vagina really stemmed from social media and what we're seeing in how people educate, and how a lot of the social media platforms are censoring and shadow banning educational content that uses correct anatomical terms. And we use vagina because it's probably the most innocent of the ones that get shadow banned, but it was really led to have a starting point of a discussion for all anatomy and all terms that are educational. And what happens is, when we're censored on social media, we create taboos, right? We're using words,
Absolutely.
down there, or cookie, or other words.
Absolutely.
So we're making it seem like on social media that these words are bad. So people that are hearing that, number one, feel that there should be shame in using those words, or they don't know how to describe something. So when we create censorship and stigma and shame and all of that, we can't educate as well. And there's so much mis and disinformation on social media that when you're blocking people that are genuinely there to educate, that have the experience and the expertise to do so, and they have to block out words and they have to censor themselves, we're hindering not just the education, but in the long run, health outcomes. Because
Definitely.
we don't know how to describe things. We don't know how to talk to our healthcare providers. So the Save Vagina campaign really starts with the word vagina, but encompasses just that whole general concept that we need to be more comfortable using these words. We need to push back on the censorship, because this isn't just about shame or stigma. This is about health. This is more than just using words. This is using words that help benefit education and benefit society and health outcomes. And that's where it was really great to see the engagement that we had, and people that, shared their stories, and some were funny and some were personal.
Were you
And
shocked by the engagement that you got? Because it was like over 2.5 million views across social media. Like that's significant. Those are women that are.
it's still going on, and it's continuing. And I'm sorry, I just wiped all the gel on my desk from my hand. But yes, so the engagement was great. And and that's part of the merchandise too, to go towards charity, but also to raise awareness. So I was at the NPWH conference 2 or 3 weeks ago, and it was both amazing to see but also in some respects disheartening. So when I got on the plane to go to Las Vegas, the flight attendant said, "They let you on with that shirt?" I said, "Of course, why not?" And they said, "Because it's offensive." And I'm
Wow.
like, okay. So that was literally not even on the plane. And
Wow.
then the next night, I'm at the hotel, and someone from the actual hotel walked up to me. I was wearing a jacket and shirt just like this, and I was sitting down. It was kind of open like this. and the employee comes and said, "Can you please close your jacket? Someone has complained." And I said, "No, I'm not. This is an anatomical." Like, I was genuinely hoping that I would get thrown. Like, I want to get thrown out of a plane, or I want to get kicked out of something for wearing a shirt that is anatomical. But that's where the social media, where everyone's voices matter, and we can really work together. Where it seems like you're on an island sometimes on social media, but that engagement really does matter.
Absolutely. Absolutely. And it was so fun to see even, generations of getting involved, moms talking to their kids, talking about actual anatomical terms and specifying what the vagina actually is, because sometimes that's really in itself something new to women. So I think it was just incredible. And I think that we have a long way to go in normalizing this, but you guys are really, you really are pioneers in this. And I'm so excited to continue to follow the campaign, and so excited that there is momentum to continue. So the profits from this campaign are also doing great things. You've decided to contribute those to charitable organizations that are doing amazing things in sexual and reproductive medicine. I mean, how amazing that ripple effect of change and of help to all the people that need help out there.
And I'll say, we're not the only people doing this, right? We put a name to something out of, and a lot of it, part of it was a collaborative effort. Like, there's other organizations like censorship and other providers and organizations that are spotlighting awareness on this. So I don't want to say that we're the only kind of tip of the spear to this, but it is nice that we are trying to help amplify the message with so many others that are seeing the same censorship unnecessarily, especially when it comes to FemTech. And we can put our voices together because we're all experiencing something similar.
Did you feel that with your company's values and mission of already having gone through the exercise of breaking through a market to create something totally new and breaking through what's considered normal, do you think that helped you with this campaign? Do you think it helped you think about having the strength and the resilience and to be public about this? Like, how did that work?
I think it does. I think when you're a small, scrappy startup, especially seeing how much the femtech industry has changed over the decades, that if you're not growing with the times, if you're not nimble, right, you've got to think so differently. And I think that starts with Sandra too. And so our team, I think, has this real general idea where we're okay with whatever idea is out there. Like, the crazier idea, everybody connects differently. So if we need to do something bold or shocking, let's do it, as long as it's legally and ethically moral, justifiable. Then why wouldn't we? So with this, I think it's a natural progression to, number one, Sandra's leadership, but just how we work as an organization, where we want to push back. We want to challenge norms, right? We're challenging the status quo when it comes to birth control. And we're trying to do the same with how we talk to people, how we educate, how we talk about birth control and sex, all of that. So I think, to your question, it really does play nicely into what we were doing, because I think our mindset is just different from the start. So it was a natural kind of progression for us.
Amazing. Okay, so tell me about so at University of Miami, we're really dedicated to education, and you guys are really dedicated to education. So give us some insights on how you think that at a college level, we can bring more education to femtech and women's health to make meaningful change.
Well, I think you all are doing such an amazing job as one of the few universities that have something like this. So kudos to you for what you're doing, because it is truly amazing. I guess that is $1 million question at any kind of university, college level. How do we bring more people into this universe? And I think part of it is trying to, number one, trying to learn kind of the true needs of the audience and the students, right? What are they interested in? What do they need to learn about? And then kind of crafting those programs, whether it be social media content or educational fairs, health fairs, programs, trainings, whatever it is, meeting the students where they are. And then as you do that, I think if you're able to get them in with something that they're genuinely interested in, it gives you the platform to share about your program and FemTech and how all of these things really benefit the students in the long run. Because I think once people get involved in this FemTech space, they're hooked, right? It
I would agree.
is contagious, and they get involved in the community and they see the people and they want to do more. So an example would be like we're working at a lot of college and universities just on birth control initiatives, right? And when you bring someone into a birth control discussion, like, hey, what's new for students on campus? And you're talking about different options. It could be Phexxi, it could be other things. But as you're doing that, you could also be talking about innovations that are coming and how amazing this space is, despite it being underfunded, and why your program is so important. So I think it really starts with understanding the needs of the students on campus, building it, and then completely bringing them into your world as much as you can.
Amazing. And how about with these students or anybody on the call that wants to get involved in advocacy? What do you think are the best avenues to get involved with that?
I think I'm assuming on campus there's probably amazing organizations, or I mean, there's so many aspects of femtech and reproductive health and sexual space and sexual health. So whether it be an organization on campus or a nonprofit, or just following and getting involved on social media, and you look as people, part of the femtech space is it needs a voice, and we need more people getting involved and sharing, and even if it's just talking, right? You can meet someone that has a question and now you have an answer about something in the femtech space. Now you're the voice for something. So find the things that you're passionate about, the organizations that you're passionate about, and put yourself out there. I mean, because it truly is such a meaningful thing to do. I completely encourage it.
So powerful. And I think maybe if you had anything to add, our last kind of question to you and to Sandra would be, what one piece of advice would you give someone hoping to make a Sandra or Mitch sized impact in women's health?
Okay, let's think big and do Sandra impact and not me. We're going to go way, let's go to the top. She's the biggest impact. I would say, personally speaking, I think the best thing you can do is be genuinely curious and try to learn and meet people. And the community is so strong, and most people want to engage. They want to meet people in this space. So do research, go on social media, find people and products and companies that are doing meaningful work and share it and engage. Like, my desk is filled with just notes and companies, and like, if you've ever known the Wondrous Vulva Puppet, like Dory Lane and Sex Ed Plus, they have these vagina models that are actually molded from actual people's vaginas, and you can see inside and internal and external. And I don't know if you can see that over there. It's called a sheet canter. It's a wine canter that is it's not really femtech, but I think it is the coolest thing ever, and it's a great conversation piece around femtech. But then, like, the technologies, like, I was just talking to MBI Annie Munoz. She's creating a speculum that a patient can place themselves if they're not comfortable with a traditional exam, or if they faced trauma before and are hesitant about pelvic exams for that reason. Like Rosie Wellness, Dr. Lindsay Harper. She gave Sandra and I a t-shirt just because, talking about how people think women's health is a niche, and it says it's not a niche, bitch.
Great. I love that.
So many people that, she's the founder of Rosie, CEO, but people that aren't just creating, but are the connectors, right? Like, Lauren, you're a connector. You want to connect people in this space. Like Georgie Kovacs at FemPower Health, Dr. Carla Loken. Like, there's a million people in companies, which is, again, why I love this job. But find those people, find those companies, be a connector yourself, be curious, and use your voice, because I think everyone's voice in femtech really is powerful, powerful, powerful.
Amazing. I don't think that could have been said better. So, Mitch, thank you again for your time. Thank you so much for all your insights. And just before we close, I want to invite everyone to mark your calendars for our next FemTech Friday session on November 14th at 12 p.m. Eastern Time. We'll be welcoming Shannon Lewis, the founder and CEO of Forever Betty, for what promises to be another hopefully engaging conversation like this one. This was so great. And we really look forward to seeing you there. So thank you so much, and keep doing all the work that you're doing, because we need people like you and Sandra in this space for as long as we can have you.
You too, Lauren. Thank you for everything you do as well.